Welcome to The Explainer. Today, we're not just talking about a disease. We're cracking open a case file on a massive public health puzzle, cervical cancer. It's a challenge that, investigators all over the world are trying to solve, and we're going to walk right through their field guide.
So, how do you even begin to tackle a problem that big? It's not just about what happens in a sterile lab or a hospital room. It's all about investigation, about following the clues and asking the right questions out in the messy real world. So, where does our investigation start? Let's open up this case file.
All right, every good investigation, every single one, starts with a crystal clear profile of the target. If we're going to stop cervical cancer, we first have to understand exactly what we're dealing with, from the tiniest virus all the way up to the big picture.
Okay, our number one suspect is HPV, or human papillomavirus. And get this, it's an incredibly common virus. We're talking something like 1 in 4 people in the US are infected right now. But here's the thing, out of more than 200 types, only about a dozen are the real troublemakers that can lead to cancer. So how's it work? Well, the virus basically hijacks a cell's DNA and forces it to just replicate over and over and over, and that's the first step towards a tumor. So the real mission isn't just finding the virus, it's tracking down these specific, high-risk strains.
Every investigation has a location, right? A crime scene, if you will. For cervical cancer, that scene is a place called the transformation zone. I want you to picture it like a really busy intersection where two completely different neighborhoods of cells meet up. And because there's so much going on there, so much cell turnover right at that border, it's the absolute perfect spot for high-risk HPV to move in and start its takeover.
And this is what we're all trying to prevent, a malignant tumor. These are cells that have just gone completely rogue, and they're growing without any controls. The real danger, and the field guide makes this super clear, is when they metastasize. That's the fancy word for breaking away and traveling to other parts of the body. Our whole investigation is designed to stop things way, way before they ever get to this point.
So, when you boil it all down, the mission becomes really, really clear for these public health investigators. It's all about finding an extremely common virus, HPV, and stopping it in its tracks before it can turn cells cancerous in this one, very specific, very vulnerable spot.
So we've got our target defined. Now the investigators can move to the next phase, asking the right questions. And this is where it stops being just about biology. This is where the real detective work kicks in, following leads that most people would probably just overlook. So where do you even start with something this big? You could just focus on the patient, but the best investigators out in the field, they know the clues are often hidden in the world around that person. So they start asking questions that go way beyond medicine and deep into the very fabric of a society. Now this question, and this is pulled right from the field guide, this is a total game changer. It asks about the vaccination attitudes of men. You might be thinking, why men? Well, because as the guide points out, in a lot of cultures, men are the ones making the final healthcare decisions for the whole family. You could have the most amazing medicine on the planet, but if you don't get these dynamics, you are never going to solve the case.
And that right there, that's the huge insight. Solving a public health crisis isn't just about the pure science of a vaccine or a screening test. It's about understanding culture and family structures and how people communicate. A field investigator learns pretty quickly that a successful campaign might not be a poster in a clinic. No, it might be a series of conversations with community elders, or maybe creating brochures that help women feel empowered to talk with their partners. The investigation has to deal with all this complex human stuff to have any chance of succeeding.
Okay, so once the investigators know which questions to ask, they start gathering the evidence. And what that means is collecting tons of data on a whole range of factors to build a profile of who is most at risk and, crucially, why. Just look at this table from the guide. It shows you the incredible range of data they collect. Investigators look at everything. You've got socio-demographics, like a person's education or income level, which can totally determine their access to healthcare. You've got lifestyle factors. Things like smoking can actually increase your risk. And then there's medical history like having HIV or multiple pregnancies, which gives crucial context. Every single data point is another clue in the puzzle. And the whole reason for collecting all this data is to spot patterns. By analyzing all these different variables, public health officials can paint a really clear picture of high-risk populations. And that allows them to shift from just a general scattershot approach to really targeted, effective action that actually saves lives. So we've got our target, we've got our questions, we've got our data. Now let's look at the actual tools that investigators and healthcare pros use out in the field. This is the real boots-on-the-ground toolkit for fighting cervical cancer. The whole approach follows this really logical three-step process. First, you screen the population to find any potential issues. Then, if you find something, you investigate it further. And all the while, you're working on prevention, trying to stop the problem before it can even get started.
So the first tool in the kit is the Pap test. This is your frontline screening method. It's a really simple procedure where they just collect a few cells from the cervix. Those cells then get sent off to a lab to be looked at for any abnormalities. You can think of it as the early warning system that flags a case for a closer look.
Now, if that Pap test comes back as abnormal, the next tool comes out of the bag, the colposcopy. This is the follow-up investigation. A specialist uses a special magnifying tool with a bright light, called a colposcopy, to get a much closer and more detailed look at the cervix to see what's really going on down there.
And finally, we have the most powerful tool in the entire kit, the HPV vaccine. This one is pure prevention. It protects the body against those specific high-risk types of HPV we talked about, the ones that cause the vast majority of cervical cancers. It's the one tool that lets us stop the crime before it ever even happens.
So, we've looked at the target, the questions, the data, and the tools. Let's debrief. Why is it so important to frame this whole thing as an investigation? What does this kind of methodical approach actually accomplish? Well, because what we've seen is that public health is truly an investigative science. It is not just about writing a prescription for a pill. It's a systematic process of gathering intelligence, of understanding the environment, identifying the risks, and then deploying the right tools in the right way to save lives on a massive scale. And when you use this field guide approach, the results are just profound. It's not just about finding patients who are already sick, it's about identifying who needs help the most before they get sick. It helps create campaigns that don't just throw information out there, but that actually change people's behavior. And maybe the biggest takeaway of all is this: the guide proves that social factors are just as critical as biological ones. It shows us that sometimes the most powerful tool for prevention isn't some new vaccine, but simply a better conversation. So we have the playbook, we have the field guide, we know the strategy. The question that leaves us with is, what's the biggest hurdle now? Is it about money? Is it about getting access to people in really remote places? Or is it about overcoming those deep-seated cultural and social barriers that this very investigation has shown us are so incredibly important? That right there is the next chapter in this case file.